So welcome for those who are just joining. We're going to give it a minute or so until everybody's online. Well, for those of you that have just joined, we're just going to give it a few more seconds until we start, just till everybody's joined. Okay, well, that's 2 minutes past. Thank you to everybody who's joined this webinar. My name's Linda Bald. I'm co-director of Behavioural Research UK, along with Susan Mickey. Today's webinar is one of two that we're holding that aims to highlight the current and future research activities of Behavioural Research UK, an ESRC-funded leadership hub for behavioural research in the UK. What the presentations are going to do is give an overview of different projects that teams are conducting in the consortium, and further information on all of these can be found on the BR UK website and by following the links that will be given on the slides. And just to emphasize, the slides and the recording will be available on the website after the webinar. The work that our colleagues are doing is also going to be disseminated, as you'd expect, through a wide range of reports, other webinars, articles, and so on. So please keep in touch via our newsletter if you're not already registered, and also our social media links. So we're focusing today on behaviour change for health, environment, and safer communities. And I'm just going to run through the key housekeeping after I introduce the speakers. So you can see on the slide here, we have Professor Graham Moore from Cardiff, Dr. Vera Buss from UCL, Dr. Elif Coker from University College London as well, and Dr. Andrew Itherburn from the University of Edinburgh. We're also joined by Professor Nick Pidgeon and also Dr. Jill Weekly from Cardiff and TRL, and they're going to be available during the discussion later on to answer any questions that either relate to environment and sustainability that Nick's involved with, or resilient communities, the work package that Jill is contributing to. So in terms of the housekeeping, many of you will be familiar with how we run these webinars. It is actually 60 minutes today, not 90 minutes this session. The chat, audio, and video functionality are disabled for today's session, but we're really keen that you have the opportunity to ask any questions about what you've heard, or indeed BR UK's work more generally. So if you'd like to submit a question as you're listening to the speakers, please put it in the Q&A box you'll see at the bottom of the screen on the right-hand side, and indicate who your question is for. And if you see an interesting question that somebody else has posted, please upvote that, because then I'll be able to see what the most popular questions are. Importantly, if you require closed captioning but cannot see this on your screen automatically, please click that CC box on your Zoom menu bar, and that will come up. So I mentioned already about the recording, and you will expect that the Q&A box won't be visible on the recording, but your name may be included when questions are read out in the Q&A section today. So we hope that's okay. You can submit questions anonymously. So I think that's it for the opening remarks from me. Thank you very much again to all the speakers. Here's the running order. So we'll be hearing from Graham first and then the others, and we'll have a good amount of time for questions and answers from the panel towards the end. Thank you. So I'll hand over to Graham.
Okay, thanks, Linda. So Linda's introduced me, but just to note, I'm speaking today on behalf of myself and my colleague Laura McGowan, who wasn't able to join today. We're co-leads on health and wellbeing research within Behavioural Research UK. Next slide, please. So health is an area in which we often think of behavioural research as being particularly well developed, but it's still the case that behavioural data and research on health trends and interventions are often quite fragmented. That includes inconsistencies in how health-related behaviours are conceived and how they're measured, and how interventions are defined and described. And often we think we're comparing things which are only quite superficially similar, or in other cases, we end up not making connections between very similar things described using different language. And perhaps particularly because there's now a lot of behavioural research in health relative to other domains, these inconsistencies can hinder systematic accumulation of a growing body of knowledge. So in relation to health and well-being, our work is going to generate important new knowledge on the measurement of behaviours to inform and evaluate policy, the use of behavioural science tools in relatively new disciplines and domains, and one potential solution to cut to some of the issues I've described here, and which we'll run through several of the talks today, is ontologies. Next slide, please. So this isn't a term we encounter much in everyday language, but as it's central to several of today's talks, and I'm going first, I'll take a moment to define it. And there are others on the group who are more experienced with these than me, and an earlier webinar and blog linked to here are good places to go to get into the detail. And the term ontology originally comes from philosophy, where it refers to the study of nature, of reality, and existence. And that's how most sociologists would use it. And as someone trained primarily in the social sciences, that's the definition that was more familiar to me until relatively recently. But when we talk about an ontology in the context of biomedical sciences, such as genetics, information technology, and increasingly in behavioral research, we mean a formal representation of knowledge within a domain. So an ontology is a structured way of organizing concepts within a field and the relationships between them using a shared language. So as an example, and this is taken from a blog on the BI UK website, if you were to use an ontology to capture knowledge and data related to swimming behaviour, you might represent it something like the figure here. So the ontology displays a number of classes within a network. Those are arranged hierarchically into child and parent classes. For example, different types of swimming strokes like backstroke and breaststroke are the child classes of the parent class swimming stroke. And the ontology allows us to specify different locations where swimming might take place and things like the use of equipment, how the behavior can be measured. So each concept within the ontology has a label that names it, a definition for the concept, a unique resource identifier that could be read by people and by machines. Next slide, please. So our work on health and wellbeing within BI UK is centered around three core research questions. So our first question is, how can ontological alignment enhance UK population data on behavioural aspects of health and wellbeing? And by ontological alignment, we mean the extent to which what's measured actually represents the concepts of interest and concepts related to it. Our second question is, how can administrative data be used to assess behaviours associated with mental health across the UK? And I'll go through each of these areas in a bit more detail, but just to note at this point, there will be a focus of this question on self-harm and suicidality, which I know are topics which some people might find distressing. Finally, our third question focuses on how behavioural ontologies can be used to improve specification of highly complex interventions with dynamic and multi-level behavioural components. Next slide, please. So our first area of work focuses on measurement of behavioural correlates of health and well-being, centred around the case example of childhood weight status. So the aim of this really is to generate recommendations to improve the consistency and alignment of behavioural measurement within and across UK population surveillance tools for young people's health and well-being. And that's important because in lots of areas of health and well-being, there are several population surveillance tools which measure essentially the same concepts and behaviours in different ways, or at times might end up measuring slightly different concepts without realising it. And that often makes it difficult to draw comparisons across nations, for example, in trends, and to use data to inform and evaluate policies and interventions in one or more nations. So we're undertaking an umbrella review of systematic reviews on behavioural correlates of child and adolescent weight status. We'll then draw together existing data sources across the UK to understand trends in the behaviours identified and map those onto behavioural ontologies to better understand where measures are or aren't measuring the same things and where we can or can't make direct comparisons. So the review is almost complete and will be uploaded to Open Science Framework in the next couple of weeks. We'll then be developing protocols for the subsequent stages of the work. And while population surveillance tools such as surveys are important, there are lots of health-related behaviours which just can't easily be captured within them for practical and ethical reasons. So that includes behaviours relating to mental health, such as self-harm, as well as suicidal thoughts and behaviours. And the challenge with these kind of data, administrative data, data collected from kind of health, social care services, is that they're usually measuring behavior very indirectly. So, for example, for self-harm, we might be measuring that via health service access for issues relating to self-harm, which will only really represent a subset of the behavior we're actually interested in. So, kind of clarity on the extent to which we're actually capturing the behaviors we want to with these data is really important. Again, here we're doing a scoping review looking at kind of correlates of self-harm across the life course, looking at routine data sets, administrative data sets across the UK, kind of mapping how self-harm and related behaviours are captured within those various data sets in each of the UK nations, and considering how those map onto behavioural ontologies. So yeah, the Open Science Framework protocols have just been uploaded, and scoping researches are beginning for this part of the work. So finally, we're interested in how behavioural ontologies can be applied to very complex interventions which aim to affect behaviour change at multiple levels. The example we're looking at is whole school interventions, and these often aim to change the climate of a school by influencing how various sets of actors act, react, and interact with one another. So they are at least in part about behaviour, even if that's not a lens which has often been applied to them. And substantial progress has been made over the last decade or so in kind of specifying behavioural interventions to aid reproducibility. But a lot of tools have to date not really been applied to many highly complex forms of intervention. There's a bit of a risk that we end up with lots of relatively simple interventions, which are kind of ultra specified, but more complex interventions continue to be more challenging to define and reproduce. So we will be kind of coding behavioural aspects of whole school mental health interventions that we've identified from recent systematic reviews using ontological tools. And we're framing some of this as feasibility work to understand the resources needed to do this kind of work rigorously for these kinds of interventions. And we'll also be doing interviews to explore perspectives on the usefulness of these tools for highly complex interventions like whole school approaches to mental health. Open Science Framework protocol has been uploaded to the first stage of this work, and piloting on the process of coding interventions is underway. So that's a brief whistle-stop tour of some of the work we're doing within BI UK in relation to health and well-being. So finally, before I hand over to the next bit, or back to the chair, just to acknowledge the team we have working on this theme across the three devolved nations. So myself and Laura, with a number of colleagues in Cardiff University, Queen's Belfast, and University of Edinburgh. Yeah, thank you.
Thank you very much, Graham. And we'll now hand over to Vera, who's going to share some information with us on the latest work on data and technology. Thanks, Vera.
Hi, everyone. I'm a senior research fellow in behavioral science and health at UCL, and I'm delighted to give you a short overview over this project, which is led by Jamie Brown at UCL and Ashley Gold at Public Health Wales. At the heart of this work is one main aim: the use of behavioral data and new technology to provide behavioral insights and improve public policies and interventions. And this overarching aim brings together several more specific ones focused on smoking and drinking. Next slide, please. Why does this research matter? There are 4 key reasons. Next, please. First, it supports evidence-based policymaking. Smoking and alcohol remain major causes of illness and early death. The decisions governments make about regulating these products have enormous impact, so having timely, high-quality data is essential. Second, it can help improve public health interventions. Many people want to stop smoking or reduce alcohol consumption. but they need appropriate support to help them. Our data provides insights into which tools people use and which might be related to success. Third, it helps address health inequalities. We know that smoking and alcohol-related harm are not evenly distributed. Less advantaged groups are disproportionately affected. Understanding these inequalities better allows services to be offered more fairly. And finally, the landscape is changing quickly. New products like vapes and nicotine pouches spread rapidly, especially among young people. Without data and rapid analysis, policy risks falling behind these realities. Next slide, please. For most of our work, we are using the Smoking and Alcohol Toolkit study. It's a long, ongoing population-based study with monthly data collection. We started collecting data on smoking in England in 2006. In 2014, we added alcohol-related questions, and since 2020, we also collect data in Scotland and Wales. Data are collected by Ipsos, a market research company, as part of a large omnibus survey. Since April 2020, interviews are conducted via phone, and before it was face-to-face. Each month, data from approximately 2,400 participants aged 16 and over are collected across Great Britain. And we are using sampling weights to match the population of Great Britain or one of the respective nations. And this allows us to get representative estimates. We call it a toolkit because it has the potential to include new questions, for example, on pressing issues or new topics. And we are happy to share our data with others. So if you're interested, please get in touch with Jamie or me. We also publish monthly updates on key indicators of smoking and drinking on our websites. And here you can see the links. So these are for smoking and alcohol, and then for each nation. And if you look at that screenshot, which shows smoking in Scotland, you can see that under the resources tab, you can find our latest survey questions and forms to fill out if you'd like to request data access. We are using several innovative research methods designed to make behavioral research more efficient and transparent. One of the most exciting is a new machine learning algorithm to make predictions more transparent. Traditional machine learning models can be very accurate, but they are often black boxes. They make predictions without explaining why, and in public health, that can be a problem. Our approach uses explainable, semantically constrained rule sets, and in simple terms, that means the computer can classify behaviors, for example, whether someone has experienced a lapse during a smoking quit attempt, but it also provides human-readable rules showing why it reaches its decision. This helps build trust, makes the model more transparent, and ensures the insights can be used responsibly in policy and practice. And we are also ontologizing data sets. Graham already explained what that means, but basically we are using existing surveys and structuring them so they can be compared or data sets combined and are more machine readable. Now I want to share some of our findings so far. I have added QR codes to these slides, which will lead you to full papers. First, the Swap to Stop initiative in England, which provides free vape kits alongside behavioral support to help people quit smoking, appears to have had a meaningful impact. Our data show that the start of the scheme was associated with a significant increase in quit attempts using vapes, and this kind of evidence helps policymakers understand what's working and where to invest. Second, we have looked at the association between food insecurity, that is not having reliable access to adequate food, and tobacco or alcohol use. We found that food insecurity is linked to higher smoking prevalence, but interestingly, motivation to quit is similar across groups, which suggests rather structural barriers than lack of desire to stop. For alcohol, the picture is more mixed. Among people who experience psychological distress, individuals who do not drink, as well as those at risk of alcohol dependence, appear more likely to experience food insecurity than others. This study shines a light on the need for more holistic support, addressing poverty alongside mental health, risky drinking, and smoking cessation. And third, we have looked at trends in the use of oral nicotine pouches. These are small pouches that are placed between the lip and the gum, where they slowly release nicotine into the bloodstream. While they are likely much less harmful than cigarettes, people can still become dependent on nicotine, and more research is needed to fully understand health risks. Our study, led by my colleague Dr. Harry Tatton-Birch, found that nicotine pouch use has risen sharply in Great Britain since 2020, especially among young men aged 16 to 24 years. Awareness of this trend has helped inform ongoing conversations around regulation, marketing, and youth protection as part of the Tobacco and Vapes Bill, which is currently discussed in Parliament. And looking ahead, we have several key analyses and outputs planned. We will be evaluating the impact of increased funding for stop smoking services in England to understand whether investment translates to more people who smoke receiving support from these services. We will be examining changes in the use of hand-rolled tobacco following tax increases across Great Britain in recent years. We will also be looking at who uses digital stop smoking tools, going beyond socioeconomic measures to understand the deeper digital divide, which is especially important as more services move online. Finally, we will continue developing and testing our transparent machine learning approach to ensure it's truly transparent without losing accuracy. So to summarize, the Data and Technology Project brings together behavioral data, innovative technology, and real-world policy evaluation. Thank you for listening, and I'm happy to take any questions during the panel discussion.
Thank you very much, Vera. And yes, colleagues, if you do have any questions for Vera or Graham or the subsequent speakers, please pop those in the Q&A box. So I'll hand over to Elif now to speak about environment and sustainability.
Thank you so much, Linda. Hello, everyone. My name is Elif Naz Çoker. I'm a research fellow at UCL's Energy Institute, and I'll be giving you a brief overview of the work we're doing as part of BRUK's environment and sustainability theme. Next slide, please. So we are interested in climate adaptation behaviors, as this is an under-researched area compared to climate mitigation behaviors, and fast action is needed as extreme weather events and heat waves in particular become more commonplace in the UK. In particular, we focus on overheating risk. What do I mean by overheating risk? So this risk in homes can be calculated by different methods that take into account things like the building's orientation, location, ventilation, window sizes, and it's figured out by the percentage of the time the indoor temperature exceeds the comfort threshold. And specifically for bedrooms, this risk is calculated by the number of hours the internal temperature exceeds a fixed threshold of 26 degrees Celsius during nighttime and early morning hours. So in this current climate with these thresholds, about half of the UK's homes are at risk of overheating. And this causes problems in health, especially with those with underlying conditions such as diabetes, asthma, other cardiovascular conditions. It also can cause disruptions in sleep in the nighttime hours, which can then impact productivity and impact the labor market. On the other hand, actions that have been taken to minimize overheating in summer through air conditioning or other efforts can increase energy demand and put increased pressure on the electricity grid. So what can people do to help mitigate all these issues? So occupant behaviors can minimize or exacerbate overheating risk in homes. Residents can make improvements to the insulation and ventilation of their homes and can correctly use blinds and curtains to keep their homes cool. So if we want to promote these behaviors, we need to think about how the structural and behavioral interventions interact with each other and how we can optimally time and order these to achieve the increased effectiveness. Next slide, please. So in the light of this, we center our work around three research questions. First, we aim to explore how different components of behavioral interventions that target psychological, social, and physical mechanisms interact to change behavior. We then particularly focus on the role of ordering and sequencing in the effectiveness of behavioral interventions. This is a particularly understudied area in behavioral science, as multimodal and longitudinal intervention studies are uncommon, especially in the energy and sustainability domain. And there's limited to no evidence on the role of sequencing multiple behavioral interventions to achieve increased effectiveness. Additionally, we also aim to investigate how the design of environmental consultation and public engagement processes, especially the way new information is framed and presented, influences individual perceptions and opinions. Next slide, please. So I want to give you a quick overview of the work that we have completed so far. Our past efforts have focused on being in close dialogue with policymakers. So along with other collaborators within BRUK, we have contributed to the rapid review and analysis of public messaging for risks of extreme heat, wildfire, and droughts. This was conducted for the Government Office of Science. You can find the QR link for the report right there. We also have provided expertise, advice, and insights for effective messaging strategies to promote sustainable behaviors in a healthcare setting through BRUK's complementary service Ask BRUK. We are also working with OECD on a policy brief on sustainable behaviors in energy, food, and transport sectors across 9 countries. We are working on an academic manuscript as well, so you can find the preprint to that in the QR code on the right-hand side as well. And finally, we have also contributed to policymaking through a briefing note to the Scottish Chief Scientist on behavior change interventions for environmental behaviors. Next slide, please. So that was all the work that we have done so far. So this is our 2 current pieces of work in progress. First of all, we are focusing on heating and cooling behaviors in residential settings with a focus on overheating risk. We are conducting a scoping review of these intervention and observational studies around these behaviors because there is a scarcity of data and evidence in this area, so we can't do a systematic review. So we're looking at doing a scoping review, trying to identify the most frequently used theories and mechanisms in this field, and trying to assess the effectiveness of existing interventions for heating and cooling behaviors. And then the second piece of work we're doing is focusing on resident experiences of overheating. We are using a very emergent and novel research methodology for this called qualitative longitudinal research to capture the role of time on practices, perspectives, and experiences of individuals. So we're focusing on this transitions and processes of change, and we are gathering insights from sociology literature in particular to inform this research. Next slide, please. Thank you. So for our future work, we will be first investigating the role of temporality and sequencing in the effectiveness of behavioral interventions. This will mainly be a theory expanding work to understand not just when, but in what order should we be implementing behavioral interventions. We want to build on existing frameworks to introduce this element of temporality to theories of behavior change, which is currently missing from the conversation. Secondly, we want to understand how the design and consultation of public engagement processes shape and influence their outcome. We want to involve people in the design of these processes, so we aim to conduct deliberative workshops with public participants to explore how the design and representation of environmental choices influence their belief dynamics and ultimately their decisions. Finally, we want to continue integrating evidence from the lived experience of occupants and designers of low-carbon heating and cooling homes. This will be done by secondary analysis of interview data of participants from 15 different energy-generating low-carbon homes in 3 case sites across 4 time periods. We believe in the value of rich qualitative data of lived experience in informing behavioral research, especially in the context of climate adaptation. Next slide, please. So all of this work is conducted by our team across 2 universities. We have Professor Nick Pidgeon and Dr. Fiona Shirani at Cardiff, and we've got myself and Professor David Shipworth at UCL. We also collaborate with Professor Karen Henwood at Cardiff, who provides insights, especially for our qualitative longitudinal research. And we also have 2 PhD students, Isabel Dean, who focuses on the role of connecting with nature in environmental behaviors, especially focusing on office workers. And we also have Charlie as our second PhD student, who focuses on the role of tenancy status, so whether you're a tenant or a homeowner, and how this interacts with your experience of overheating risk and what sort of mitigating actions you take. That's all. Thank you for hearing me out, and feel free to reach out to any of us if you have any further questions. Thank you.
Thank you very much, Elif. Excellent. And we'll now hand over to the final presentation from Andrew on resilient communities. Thanks, Andrew.
Perfect. Thank you, Linda. Let me just transfer over to the slides. Can everyone, I think this works. Okay. Yeah. Hi, everyone. My name is Andrew Ithaburn, and I'm a part-time research fellow with Childlight, which I'll explain what Childlight is in a second, and with BRUK, working with Professor Deborah Fry, who actually could not be here today. I'll be also talking about the road safety portion of the Building Safer Communities in place of Dr. Shaun Helman, who also is a co-lead with Professor Fry, and he also could not be here as well. Before I begin, I will preface that I will be partly discussing today some sensitive and possibly distressing topics such as child sexual exploitation and abuse. I'll be also, for brevity, I will just call this abuse, but that's in place. As I said, I work at Childlight, which is a research institute and charity hosted by the University of Edinburgh. Our goal and mission is to safeguard children from abuse and investigate the prevalence and nature of this abuse. We are now working in partnership with BR UK to use a behavioral science component to address this topic and look at the behavioral mechanisms that draw this. Now, the importance of the research specifically for online child safety is why this area of research is important. Well, sexual exploitation and abuse is a major public health threat that affects every aspect of life, from the child that is being abused to the community at large. Every year at Childlight, we release the Into the Light Index that tracks and discusses the prevalence of this abuse. In this index, this year, 1 in 15 children report experiencing rape or sexual assault by the age of 18. This is only getting worse, especially with the advent of technology-facilitated abuse. Increased research on not just the prevalence is important, and one of the reasons we are in partnership with BR UK is to understand the psychological and behavioral factors influencing the spread of child sexual abuse and understand new ways to combat the spread. And I have the link down here to our most recent Into the Light Index that can go into more detail. Now, we have one overarching main research question, which is what/how can behavior change techniques be applied to guide developments of evidence-based prevention and intervention strategies to building and developing a better online safety environment. Along with the two research questions, we had two secondary research questions, which are, what are the intervention pathways for increasing online safety? And the second is, what psychological characteristics exhibit around harmful behaviors that influence unsafe communities and harm? Our research questions are not answered by one project alone, but seek a holistic approach where each project seeks to answer multiple questions. Next, I will touch upon those new and exciting projects as well. We are going to be using a multitude of different and exciting research methods, some of which are similar to the research methods discussed earlier in the webinar. For example, what Graham discussed, ontologies. First, we will be doing surveys and firsthand data collection to understand the psychological, behavioral, and sociocultural, which means the social or cultural culture that one is in, that might influence message acceptance around child sexual violence framing. In particular, we'll be using short surveys or vignettes for this. We, like Graham said in the beginning, will be doing an ontology to standardize the data and be cross-disciplinary. We'll also, through this development, we'll also create a behavioral pathway of how people take in and process the messages specifically around online child safety and possible intervention strategies therein. This will employ both secondary ontology data, but also be informed by survey data. Now, I will briefly touch upon the road safety project that is led by Shaun Helman. So for the importance of road safety research, speeding vehicles are a major contributor to road harm, and it is accepted that we cannot simply rely on the enforcement. People also have differing motivations for speeding and sometimes see it as acceptable. Thus, it is right for intervention using behavior change methods to help shift beliefs and behaviors. So like in the online child safety, there is one overarching research question and then two secondary questions. The main overarching research question is, how can we use behavioral science to change beliefs and behaviors around vehicle speeding? And the two secondary are, how do beliefs and attitudes around the behaviors manifest in a community and how they can be shifted? And then finally, how does behavior change interact with other businesses/fleet priorities? So this research will also use novel and exciting research methods for this as well. They're going to be looking to build a behavior change intervention in collaboration with the community we implement the intervention for. So for example, work with the community of drivers in an organization or sector, such as large fleets or home delivery services. And then working with the Driving for Better Business, which is the membership scheme for fleets run by the National Highways to gain access to potential partners. And then down here is the link to the Drive for Better Business website. Now we have two overarching impacts that we're seeing that we would like to see specifically for the online safety. Preface all research with no child should be ever at risk of exploitation or abuse. And we hope that this research leads to more informed policy decisions, such as the Online Safety Act, which is currently in effect and being modified to update to new information. We also want to hope this will stop the exploitation and abuse before it happens and use intervention strategies that will be informed by the research and the ontologies. And then we hope that this will be a cross-discipline joining of researchers and policymakers to grab a more holistic approach to policy and research changes, especially for children. And then for the for the road safety, we're seeking to have safer roads. We're creating safer communities for everyone, a safer driving habits informed by research with policies and best practices informed by what is actually happening, and to hopefully reduce and hopefully eliminate road casualties and fatalities in the UK. So thank you for this. And I'll be happy to answer some questions along with Jill at the end of this.
Thank you very much, Andrew. So colleagues, as you can see, there's a wide range of work here on different topics across the 4 themes we have in BRUK. What connects all of them is common theories and methods, including innovative methods, as Andrew has just described. But we're also very keen to influence policy and practice. And I think Vera already gave some examples of how the toolkit has done that over a number of years, but we're certainly expecting the new studies to be able to do that as well. And one of the elements that helps us there, of course, is that we have partners in the consortium from government and other sectors who can help us enhance and build those pathways to impact. So I don't see any questions in the Q&A, but if anybody's got any questions, do pop them in there. Is there anyone online who wants to pop their hand up and ask a question at the moment? Or are you happy just to put questions in there? So I've got a couple of questions for the group, so I will kick off, but please do, to the audience, put any questions in the Q&A. There was a question earlier just about not being able to read some of the QR codes. And you'll see that Sanja has popped in the chat that we will send these out after the webinar. And you'll also see that Elif has put in the chat under the answered questions, one of the links to our publications so far, which is some work we did for the Government Office for Science, looking at extreme heat, wildfires and droughts. And we did that last summer. So thank you, Elif, for doing that. So let me just kick off with a few questions then while we see if anybody is going to pop any in the Q&A. So Graham, just on the whole school mental health interventions, can you give us some examples of what those interventions might involve? And also just explain a little bit more why we've not used ontologies or other frameworks to think about those types of complex interventions that happen across a whole community, in this case, a school. So really welcome any thoughts on that.
Yeah, in terms of what they might involve, I mean, the whole school intervention is quite a broad umbrella that covers some quite different interventions, but they tend to include a focus on curriculum, but also a focus on sort of changing the school environment, and often that's through identifying kind of groups of young people and staff and bringing them together to kind of review existing policies and to review kind of behavioural policies across the setting to kind of implement changes that are kind of data-led. And I think there are kind of ways in which their theories of change implicitly tend to be about kind of changing the way that staff and students interact with one another, or changing the ways that students interact with one another. So there are strong kind of behavioural elements there. I mean, I think they are often developed probably in disciplines that don't view them through that kind of behavioural lens, which is probably partly why these tools haven't been used. But I think also because there is quite a complex kind of web of causality associated with them, they don't kind of follow a sort of quite neat linear causal pathway, which makes them quite difficult to model in this kind of way. So I think we are kind of finding that some of the piloting is quite difficult, but it would be interesting to see kind of what we find in terms of kind of how usable some of these tools are for kind of picking apart some of those things.
And is part of the aim then, if once you do that work, you would be able to develop some guidance or advice for schools if they're thinking about developing new interventions in the future, how to do that in a more rigorous way?
Yeah, whether it's schools themselves or the kind of policy stakeholders who work with schools. So here in Wales, for example, we have groups of healthy school coordinators who work with schools to help them to implement whole school approaches. So they would be kind of key stakeholders who you'd imagine might benefit from some guidance in this area.
Great, thank you. And to Vera, you've given us some examples from the toolkit over a number of years, and that's obviously a repeat cross-sectional survey that uses very robust question design to ask people about their smoking and drinking behaviors, and also, as you pointed out in the paper on food scarcity and people experiencing challenges with household income can also have other questions added to it. But I wondered if you could give us a bit more information about previous toolkit outputs and how they actually have influenced policy in the UK. There's a piece of legislation going through Parliament now that might be relevant, but there might be other previous examples that you want to highlight. Thanks.
Yeah, thank you. One example, for example, is the Stoptober campaign. So people are encouraged in October to stop smoking, and the idea was sort of inspired by the toolkit because we could see in the data that less people try to quit around this time of the year. But it was also later used to evaluate the campaign and to see whether it was effective. And we generally work quite closely with policymakers in all three nations, and that often gives us also inspiration of what kind of questions are relevant for policymakers. And currently there is a ban on disposable vapes, so we are also looking at the effect that had on people's choices of which devices they are using. So, for example, we saw that even before this ban came into place, when it was announced, people already started transitioning to other types of vape products.
Great, thank you. Those are really, really good examples. And I think, again, for our policy partners, just seeing the impact of the changes that are made very rapidly from the toolkit is helpful. So Elif, just onto your presentation, I think there's a couple of things that colleagues might be interested in there. I wonder if you could tell us a little bit more about the findings from the OECD study across 9 countries, and also just give us a little bit more information on the qualitative longitudinal data set that you'll be using for the next stage of the work. Thanks.
Thank you so much, Linda. So I'll answer the first part of your question, and then I'll hand it over to Nick, who can talk to you more about the qualitative longitudinal research. Sorry, tripped over my words there. So the OECD study we looked at 9 countries, and we looked at a big survey data set that asked people to self-report behaviors around energy consumption in the household, food consumption, and transportation behaviors. And the countries were mainly in Europe, but we also had United States, Canada, and Israel, in addition to 6 European countries. And we found that in general, unfortunately, people underreport sustainable behaviors. So the majority of the population is still using cars as their primary method of transportation. They're still eating a lot of meat and seafood and not really eating organic or seasonal products, or using a lot of plastic and packaging when they're purchasing their food. When it comes to energy consumptions, they don't really install energy saving devices or insulations to their buildings. So we're seeing this kind of lack of sustainable behaviors all across the 3 sectors in these developed nations. But we are seeing a correlation between people who tend to be more sustainable and increased support for policy. So we're seeing the people that are trying to make changes in their lives are actually a lot more open to government support, and they are wanting to see better policy support in all of these 3 areas. So I think that's some of the key highlights that we found in that paper, but please check out the preprint, and then hopefully there will also be an even shorter policy brief that will be published soon. And I'll hand it over to Nick for the QL research.
Okay, thank you. Yeah, I mean, as with survey work, of course, longitudinal data sets aren't that common. But it's even more so the case with qualitative research, because it's actually quite difficult to keep people involved when you've got a relatively small sample. But we do have access to a data set that in Cardiff we've collected over about 4 or 5 years now. These are residents living in what were new build homes, some of them are about 5 years old now, they had a number of energy interventions in them, i.e. solar panels, high insulation, other technology to reduce their carbon emissions. But as it turns out, heating hasn't necessarily been always thought about by the designers. The data set was interviews with residents before they moved into the home to get their expectations of what it would be like, then immediately after moving in, then after a year, and then after 3 years. And the reason why we do the year and 3 years is that behaviours in new contexts like homes don't suddenly emerge immediately move in. So you've got to look at, and in relation also to adaptation and heat, there's also a heating cooling cycle to take into account. So that's during the summer, during the winter, how are the homes performing and people's changes in practices and behaviours occurring over that. So that's the data set we're using. It's a very large set of data, I should say. Just looking at Linda there, your question. So, which has been analysed for other purposes, looking at mitigation behaviours. But we're very interested in this interaction between an intervention, which is the home, for basically to reduce carbon emissions. How does that relate then to the adaptation question? And what can we learn about the sequencing issue, which Elif has talked about already, that will help us take this question forward? Thank you.
Thanks. And you can see some of the implications for future design or interventions there. That's really helpful, Nick. So for me, because I don't see any questions in the Q&A, but again, information that might be helpful to the audience. First to you, Andrew, and then Jill, I'll bring you in if that's okay. Can you give us a little bit more information, Andrew, in relation to the relevance of the work that you're going to be doing with Childlight and BR UK for the Online Safety Act? So that's obviously a new piece of legislation. And my understanding is it makes it illegal for abusive content directed at children or affecting children to be online in the UK. But obviously there are ways to improve that legislation. So what are the kind of intervention strategies or other findings that you're thinking might come out of the new research that would be helpful and informative to Ofcom and the other colleagues looking at that legislation?
Thank you, Linda. That's a really good question. So for the Online Safety Act portion of the research that we're working on in partnership with Ofcom, we're looking more at the messages that are coming out about the Online Safety Act and how certain people are taking in that information. So in that case, we are creating these sort of messages that are using different messaging techniques like punishing. Is this going to be like a sort of punishing technique, like if you don't follow this rule, this law, these things will happen. So we're using that kind of aspect but then seeing what psychological and behavioral components or characteristics that are of the individual that makes it so that they're less likely to or more likely to agree with a certain messaging. So by using that foundational framework of understanding why this may be more persuasive in this case, then we're going to see be a possible implementation of that, either pre-interventions that are before anyone has even processed the information, or post that is more of like a mitigating or stopping or sort of that nature. And so hopefully this will be able to be used in messaging campaigns that Ofcom releases or the government releases and things of that nature as well. Thank you.
Really helpful. Thanks, Andrew. So Jill, finally to you, the work that you've been doing with TRL, with BR UK, you've already completed a literature review looking at ontologies in relation to speeding, driving behaviour, and an experiment looking at messaging to try and reduce speeding. But I know many colleagues will not be familiar with the methods that TRL uses that are real life experiments with drivers. And Andrew touched on some of that, but I wonder if you can just explain to us in a practical sense, when you're thinking about testing a behavioural intervention, what actually happens in this real life lab that you use with fleets and the partners that you have through National Highways. Thanks, Jill.
Sure, thanks, Linda. I'll do my best to answer that. Yeah, as you say, in the first part of the work, we did a kind of pilot study, and that took place in Woolwich, where TRL has got it's called a living lab, which basically means there's all of this roadside infrastructure, and it allows us to track the vehicles and the speeds of vehicles as they go along those instrumented roads. So what we were doing in that pilot study was we put up a road sign, and we were basically just trying to use that, use the instrument road to check, not check, what's the word? To test out different methods of data collection for monitoring speed. Now, the intention for the main part of this work, as Andrew touched on, we're going to be developing a new intervention. We're going to go into work with fleets and Driving for Better Business and develop that intervention with them. Sort of co-creation kind of process to develop that intervention and really understand how that is delivered and how it actually impacts those specific drivers that it's been designed for. And the idea is to, track motivations, beliefs, attitudes, and that kind of thing with those drivers, but also their actual speeding behaviour. We anticipate getting that probably from telematics, but also again possibly through this roadside infrastructure, depending on where these fleets are located.
Great. So really useful to hear about the participative element of it, but also some of the techniques that we use to actually look at driving behavior. Fantastic. Okay, so I'm not seeing any questions in the Q&A, but those of you that are with us can see in the chat that Sancha and other colleagues have posted multiple links to the material that's been mentioned in the presentations, but also some information on how you can catch up on other aspects of Behavioural Research UK's work. So I'm just going to share some very final slides now, Sancha, if that's okay, just in terms of highlighting some upcoming elements in relation to the webinars and also our conference.
Two minutes. Apologies.
So while Sancha's bringing up the slides, just to highlight that our next webinar is on the 2nd of March, called Building Behavioural Research Capacity, Methods and Impact. So this is looking at our work packages in Behavioural Research UK, 2nd of March, 11 to 12. You can register via the BR UK website, or also the link that Sancha's put in the chat. And finally, we're having a conference, again, with thanks to our funders, the Economic and Social Research Council, on the 30th of June of this year at the University of Birmingham. Abstract submission deadline is the 26th of February, but just to flag now, we are considering having a late breaking abstract format as well, but that's the deadline for the main abstract submission. We've got some fantastic keynote speakers, Professor Rolf Hertwig from the Max Planck Institute for Human Development in Berlin, and Professor Paul Taylor, who is the UK Government Chief Scientific Advisor for Policing and also Chair of the UK Government Social and Behavioural Science for Emergencies Group. So do join us in Birmingham, 30th of June. The information is there, and also there are more details on the conference website. So it just leaves it to me to say thank you very much to all our speakers for sharing both some of the previous work that we've done, but importantly, the work that we're now pursuing as substantive projects in BR UK across the themes, and also to those of you that joined. And if anybody missed the webinar and would like to catch up, it will be available on our website. So we'll end the webinar now. Thank you.